Hi everyone, I'm Sir July, and for these slide sets, we will be discussing the stages in the course of infectious disease. The progression of an infectious disease can be divided into stages which are related to the intensity of symptoms. It begins with the initial exposure to the microorganism. These stages are the incubation period, the prodromal period, the period of invasion, and the convalescence. It may last from several hours to years depending on the microorganism. For instance, you can see in this slide that Ebola has an incubation period of 1 to 21 days. That means that when someone is exposed to Ebola, it may take 1 to 21 days before symptoms start to appear. Some diseases could have shorter incubation periods such as cholera or longer incubation periods such as HIV. Take note, the incubation period is important because it is the basis for quarantine. Going back to Ebola as our example, individuals exposed to it may be quarantined for 21 days. You may remember as well that early COVID protocols require quarantine of contacts for 14 days. For the virus that causes COVID-19, its official name is SARS-CoV-2, researchers have found that the typical incubation period is about 5 days. About 97% of the people who get infected and develop symptoms will do so within 11 to 12 days, and about 99% will develop within 14 days. So that 14 days quarantine period was based on that incubation period. Prodromal period is the occurrence of initial symptoms, which are often very mild and include a feeling of discomfort and tiredness. At this time, the patient may have a feeling that he is coming down with something, but is not yet sure what it is. The period of invasion is also known as the acute period. During the period of invasion, the pathogen is multiplying rapidly, invading further and affecting the tissues at the site of initial colonization, as well as other areas. The immune and inflammatory responses have been triggered. Symptoms may be specifically related to the pathogen or to the inflammatory response. The height of infection happens at this stage such that symptoms are very pronounced. To summarize so far in terms of intensity of symptoms, during the incubation period, there are no symptoms. During the prodromal period, there are mild non-specific symptoms, while during the period of invasion, symptoms are very pronounced. White blood cells may either increase or decrease and can result to death if immune response or medical intervention fails. During the convalescent period, the patient regains strength and the body returns to its pre-diseased state. In short, recovery has occurred during the convalescent period. For some authors, this course of illness is actually divided into 5. Between the height of infection and the convalescent period, there is a period of decline where signs and symptoms subside. According to Famorca, it is during this time that the patient is vulnerable to secondary infection. Convalescence does not occur at all times. Alternatively, the disease may be fatal or may enter a latency phase with resolution of symptoms until a reactivation at a later time. An example is varicella or chickenpox, which is an acute infectious disease. It is caused by the varicella zoster virus or VZV, which is a DNA virus that is a member of the herpes virus group. After the primary infection, VZV stays in the body, specifically in the sensory nerve ganglia as a latent infection. Primary infection with VZV causes varicella. With advancing age or immunosuppression, cell-mediated immunity to VZV declines and the virus reactivates to cause zoster or your shingles. So let us summarize this presentation. The course of illness is divided into 4 to 5 stages. The incubation period is the interval from exposure to first symptom. At this time, there are no symptoms yet, and the incubation period is the basis for quarantine. Initial, mild, non-specific symptoms present during the prodromal period. The period of invasion is also known as the acute period. It is at this time that the infection is at its height with pronounced symptoms. Take note as well that during the period of invasion, the infection may spread to distant sites. During the period of decline, the symptoms decrease in intensity. And lastly, recovery occurs during the convalescent period. Pause this video, gather your thoughts, And when you are ready, let us have a practice test. For the first question, the symptoms are maximal during which stage? A. Incubation, B. Prodromal, C. Acute, D. Convalescent. You have 5 seconds. If you answered C. Acute, you are correct. Remember that this is the period of invasion where the height of infection occurs. Next question. Stage of recovery. A. Incubation, B. Prodromal, C. Acute, D. Convalescent. You have 5 seconds. And the correct answer is D. Convalescent. Student A asks that he be excused from class as he feels he is coming down with something. He has mild and specific symptoms. He probably is in which stage? A. Incubation, B. Prodromal, C. Acute, D. Convalescent. You have 5 seconds. If you answered B. Prodromal, you are correct. And for the last question, the first stage in the course of illness disease: A. Incubation, B. Prodromal, C. Acute, D. Convalescent. You have 5 seconds. A. Incubation is the correct answer. If you got all 4 answers correct, you did a great job. If you failed to answer some of the questions, you may rewind this video for mastery. That's it for this video. Do not forget to subscribe to my YouTube channel, Memory Aid Nursing. Thank you.